I believe we're all living with HIV and AIDS. Some of us with it in our bodies, some of it with it in the rest of our lives, with our friends and loved ones, in our families and communities.
We all know, and we've known for over 25 years, the enormity of this pandemic. It's devastation. We are living in a global community today. Everything is connected. If we're not infected, we are affected.
We are so lucky that HIV did not occur 100 years ago, or even 50 years ago. If it had, that would be the end of humanity.
It's hard for people to understand that in the 80s, as a gay man living in New York City, I went to more memorials than I did movies. Everyone I knew was either infected or knew someone who was infected or was touched by a friend, a family member, somehow. We were all directly connected to the epidemic in ways that I think it's hard for people to understand today. And I think a lot of us at the time were angry at the lack of response of our government.
We needed to do research. To start with, there was no money coming from the federal government, no resource anywhere for doing this specifically. And we had a sense of urgency and a sense of drama and dread. We had the people around us dying every day. In the summer of 1985, Elizabeth Taylor, who was a great friend of our cousin, had been very shaken by losing him and shared our concerns.
So you have an organization in the West Coast with Elizabeth Taylor, very inspired, with extraordinary access, and then you have an organization in the East Coast, Mathilde Krim, more scientific in its foundation. The two entities come together and form amfAR, the American Foundation for AIDS Research. And 1 + 1 equals a lot more than 2.
amfAR truly facilitates the process of discovery, the acquisition of new knowledge.
amfAR is one of the few organizations in the world that focuses all of its resources on research.
The Krim Fellowships are an excellent example of how amfAR facilitates the entry of young scientists into the field of AIDS research. They'll be the leaders of tomorrow.
Research in the world of amfAR is a research that is engaged, is a research that responds to the community of those living with and very vulnerable to HIV and AIDS.
Research isn't just about test tubes and microscopes. Research is about touching people.
I think that policy is currently the biggest issue regarding HIV/AIDS. We have shown that if we change policies, we make a difference.
amfAR battled for AZT to be used for women and pregnant women, and it battles for breaking the scientific field into new levels of response. It's work with needle exchange programs, advocating for that, publicizing the science around that.
When I began to do syringe exchange, it wasn't quite legal. amfAR was pushing for the needle exchange in the early 1990s, and it worked.
We are lobbying, we're advocating, we're agitating in some cases for legislation that responds appropriately to the epidemic, whether it's the travel authorization that allows people with HIV to enter this country legally, or it's the Ryan White Care Act.
It was an extraordinary triumph of common sense, decency, and justice over prejudice and bigotry and hatred. And amfAR was the instrument that made the important difference in that debate.
Research has to be more than just about finding the answer. It has to be about making that information known. It has to be about making that answer known. And that means making it available to the people who will benefit from it.
amfAR has supported educational and collaborative activities that no one else has supported to that extent.
It's incredible respect in the field as a source of accurate information. I'm talking about medical information, scientific information.
When treatment became possible, we also developed an education program public education and later on also professional education, nationally first and then also internationally. And now we have a very important international program.
amfAR stood for the American Foundation for AIDS Research. Today, amfAR stands for the Foundation for AIDS Research, recognizing that AIDS is not an American problem, it's a global problem.
Even 10 years ago, at amfAR, we understood that the epidemic was pivoting towards Asia.
We're in Asia, we're in Africa, and we are working together on a global level to bring healing in the area of HIV and AIDS.
We have programs, particularly our new initiative around men who have sex with men, which is funding global grants throughout the world.
The AIDS pandemic still kills millions of people every year. It's a huge death toll. I think about 1 in 25 of all the deaths that occur in the world are due to HIV or AIDS.
And the only way that we turn that around is to leverage the kind of resources that fund the kind of research that brings us answers. After all of the work that we've done so far has just bought us time.
That's why research is so important. That's why the kind of activist engaged prioritization of research and moving is so important. That's why, the connection, the local connections that amfAR has and the partnerships that it has are so important.
amfAR has the credibility. It's a well-earned credibility. It's based upon solid achievement and accomplishment. And it is bringing that credibility into the world community.
amfAR stands for creative, innovative, relentless research.
I think amfAR stands for a singular focus, a singular quest to end the AIDS epidemic.
And amfAR is going to stand for victory one day.